Good morning. I'm Dr. Manoj Kumar. Here I'm going to describe about RIRS done with fans sheath. Fans means flexible and navigable ureteric suction access sheath. So in this video you can see this is the fan sheath where you can bend the tip easily, and this is the normal sheath where you cannot bend the tip. So here I am going to describe the bending of the sheath with the scope inside. So this is the scope inside the sheath, and you can easily bend the sheath along with the scope. This is the maximum I think you can bend the sheath with scope inside. Coming to the surgery, this is a case of left renal calculus of size approximately 1.3 centimeters. So in this I passed access sheath under CM guidance with two guide wires, one inside and one outside the sheath. So after removing the obturator, I passed flexible scope. This is the flexible scope inside the kidney. So this is the video. I am passing the scope through the sheath. So the sheath is already inside the kidney beyond the PUJ. So I have inspected all the calyces. The stone is located in the lower calyx. So I thought it would be better to relocate the stone from the lower calyx to either middle or upper for better fragmentation and better navigation of this fan sheath. So I used basket to relocate the stone from the lower pole to, if possible, upper pole or middle pole. But as the stone is very large, I cannot push it into the upper calyx or middle calyx because of narrow openings. So I decided to reduce its volume. Later I could do fragmentation once it is in the calyx. So initially I want to do reduction of the volume by dusting method. This is a soft stone. You can see it is easily fragmentable. You can see the dust floating inside the pelvis in the fluid. So you see when the dust is floating, there is a little bit decrease in the vision. So the advantage of RIRS with fans is you can do suction intermittently also. On the right side video you can see I am pressing the valve on the side port so that automatically the dust whichever is coming from the stone is sucked out through the side port. You can see in between I just came into the suction sheath. You can see the fragments coming out of the sheath. So it will give you better vision. Once the dust came out of the kidney, it will give you better vision. So once the volume is less, I pushed the stone into the calyx, and I purposefully did fragmentation using popcorn technique so that I could suck all the fragments through fan sheath. You can see there is a little bit decrease in the vision. So again I did suction. So there is a decrease in the vision. I did bit of suction. You can clearly see there is an improvement in the vision. So once you are happy with the size of the fragments, better start aspirating the fragments. So for this you have to press the side valve on the side port, and you have to your scope. You have to remove the scope until the edge of the side port so that the fragments will go into the side port and into the container. So this is how we have to come out and again go inside, and we have to be very careful and we have to be gentle not to injure the scope while coming out and going inside. So these are the fragments easily being sucked out. So these are the last fragments left. Coming out with suction. So this is the clear calyx after sucking dust and fragments. So while coming out also there is some dust located in the pelvis, which I did suction. You can see the dust I'm checking. You can see on the right side dust is coming through the side port and it is collected into the jar. While coming out also you can do suction. So I just pushed the scope beyond the sheath and I want to inspect the ureter. There is no injury with the access sheath. So I kept a stunt. So these are the fragments and the dust, which is you can see in two separate compartments in the container. So this will prevent the recurrence in the future. Thank you.